Welcome to another edition of Ask Dr. George, and today we're going to talk about TMJ, jaw pain. So let's get to it, Dr. G. First of all, what is TMJ? I keep touching my jaw when I talk about it.
Yeah. TMJ stands for Temporo-Mandibular Joint, which is the joint up in here.
Oh.
That's our joint back in here.
Okay.
And TMJ is kind of it's a misnomer. It's TMD would be temporomandibular disorders would be what we actually call it in dentistry. And there's quite a number of temporomandibular disorders, but basically what's happening, the main gist of what's going on with TMD disorders for the most part, it's related, it's got a number of causes that are at the root of it.
Okay.
But mainly I think it's a disease that we see a lot in our society because we're very go, go, go and we have a lot of stress.
Right.
And so TMD seems to arise for the most part in people who are experiencing a lot of stress, and because of that their body, they're taking out some of that stress, and it could be from postural issues, it could be from bite issues, but basically what's happening is that they're either clenching or grinding, okay, and putting a lot of pressure. And what happens is that if you're clenching or grinding, then somewhere something is going to give out, okay, because you're overloading the system. And there's a number of places where clenching or grinding could end up manifesting itself. So we could see wear on the teeth.
Okay.
We could see looseness of teeth. We could see chipping of teeth. We could see the muscles that are overworking might get tender or sore. We might see that we have a joint issue instead, so that, or we may have pain in the neck muscles. So there are a lot of different things that could break down in the system. And typically the weak link in the chain is what's going to show up. So some people who are experiencing these kind of issues, I'll see them with really worn out teeth, but they don't have any problems in their joints.
Okay.
We'll see others that the muscles are inflamed, but the joint is still okay. We'll see others where they don't really have any other symptoms, but their joints are getting sore. And so it really masquerades as a wide variety of different symptoms, from headaches, jaw pain, muscles that are sore, like I said.
Right.
And so because of this, we have a number of fields of medicine that work to help relieve TMD symptoms for people. So for instance, we have physiotherapists that come in and they have seen in their studies that there are links between bad posture and TMJ. So they'll, for instance, work on strengthening back muscles and getting your posture better, and they have seen some correlations with that helps decrease TMJ in some patients.
Okay.
We see that the medical profession gets in on this sometimes, and what they do is they try to treat the stress end of things.
Right.
Because if you take away the clenching and the grinding and the stress, well then all the rest of it settles down. And so they might come in and they may be prescribing antidepressants, they may be prescribing various drugs to try to get you to chill out a little bit and not be so tense. So that's a lot of times where the medical profession comes in. We have massage therapists who deal with people who have the sore muscles part of TMJ. We'll have chiropractors who try to come in and adjust the jaw if the disc has been dislocated in the joint, or they try to do various adjustments to try to settle that down. And then of course we have the dentists who will look at bite issues that might be related to to this TMJ problem that you might be experiencing.
Mm-hmm.
And so all of these professions have success in treating TMJ, but I think it's important to understand that not all TMJ is the same. There's different causes, there's different things that are going on, and the first thing that we need to do is, first of all, try to get to the bottom of what's causing the problem.
Right.
And then we can figure out who's the best person to treat this, right? And sometimes what we'll find in dentistry is that people may have an underlying bad bite, okay, that the teeth don't fit together very well, and that's what's causing them to have muscle pain because the muscles can't find a stable position for the joint. The joint itself could be getting hammered. We may be having issues like that.
Okay.
How do we know that the bite is related to all of these issues? Is we know that if you have dental work done and we screw the bite up, we can certainly cause you to have these issues that you may never have had before. So if you reverse that and say, well, you may be having these issues because of a bad bite, we know that the bite is related to these issues. But the question that we always have to ask ourselves is, did your bad bite just suddenly occur this week, or have you had a bad bite all your life? So why is it that this week you're having TMJ pain and last week you did not have TMJ pain? So something had to have changed, and it's not likely going to be your bite that has changed. And so I think dentistry sometimes falls into that trap where we're trying to treat, a bad bite as that's the cause of the problem, when it's actually not the cause of the problem. It's a factor that's exacerbating the problem, but it's not the cause. The cause is most likely the stress. Right? So you're going through a stressful time, you're thinking and you're clenching while you're driving or while you're on your computer or in your sleep, and that is overloading the joint. Now certainly having teeth that don't line up is going to exacerbate that problem. And so we may be able to do things in the dental profession to help alleviate some of that. But the stress is still going to be there, right? So I prescribe a lot of yoga, red wine, and vacations.
Yay!
And those things seem to help even more than a lot of the things that I can do. So the simplest thing that we can do in the dental profession for TMJ is we can put people into various kinds of bite splints that help remove that bad bite factor.
Okay.
Right? Because I've seen patients who have horrifically bad bites, unstable, they don't seem to have any contact, and they don't have any TMJ problems at all. And then I've seen people who appear to have a wonderful bite and they have all kinds of TMJ symptoms. So there are relations between the bite, but it's not just about the bite. There's other things going on in people's lives, and we need to sort of get at the root cause of what's going on here. So if I'm going to treat somebody, and there are occasions where I do, then generally it's because they've blown out all their teeth.
Okay.
So if somebody has, destroyed their teeth, that's generally when I'm going to get involved, because they may want to reconstruct their teeth for aesthetic purposes and for functional purposes. And so in that kind of situation, it's going to be very important that when I rebuild their teeth so that they can smile and function again, that I build them into a good bite. That I don't build them into a bad one that's going to maybe cause, that the clenching, if they come into a stressful period, the whole thing could fall apart again. Because obviously the first time they had teeth, they blew all those out.
Okay.
So, just because I rebuild them all with crowns doesn't mean that you won't be able to blow them out again. So having the bite set up perfectly plays a very important role if we have to reconstruct. Now, if we don't have to reconstruct, then we need to take a look at what other kinds of things that we can do. And in the dental profession, we have a lot of dentists don't understand these processes very, very well. And what ends up happening is that anytime anybody has any kind of TMJ symptoms or muscle symptoms, they just say, well, you need to have a bite guard.
Okay.
And they put everybody into the same kind of bite guard. And the problem is that it's probably not effectual for most people. And so we see a lot of people who have these night guards and different things, and they don't wear them because it doesn't seem to be providing the relief that they really require. And so I think we need to take a step back and really understand what the problem is. There's a big difference between somebody who grinds their teeth, somebody who clenches their teeth. Those are not the same things. Okay? And if you put a night guard into somebody who clenches, then all they're going to do is clench on the night guard.
It's
so
not
solving the problem. Now, instead of clenching on your teeth, you clench on the night guard. Now, for some people, that will provide some relief, because if the bite wasn't good, then clenching on that night guard eliminates that bad bite. But they're still clenching. And so what we want to do for our clenchers, the people that are having the headaches, the people that are overloading the joint, is we want to decrease their ability to clench. So what we use is a special kind of appliance called a relaxer, and it's very, very effective at getting people to decrease their ability to clench. Okay, so just so you understand how that works, so imagine, if you will, that you're clenching your teeth together. Yeah. Okay. And so what we want to do is we want to stop that from happening. So let's just do a little experiment just for fun. Put your fingers on your temples, and those of you who are at home, if you want to do this, you can try it as well. So put your finger on your temples and bite your teeth together. You feel the muscle
Yeah.
firing?
Bulging.
Yeah.
Yes.
Right?
Yeah.
Okay, so when you do that, you feel that muscle bulging. And the reason that that's happening is because when you put your teeth together, every single tooth in your mouth has a suspension system. And in the suspension system, there are nerves or sensors. And what those sensors do is they help you to know where you're chewing. They're pressure sensors.
Okay.
So when you bite down, these pressure sensors send a signal to your brain that you want to chew something. Okay? And they activate all these muscles. We call these the muscles of mastication, or the chewing muscles. So when you bite on your back teeth, it sends a signal you want to chew something, and the system activates all its force muscles, all these muscles.
Right.
So you can imagine that if you were walking around all day clenching, these muscles tight all the time, it can cause headaches, it can cause muscle soreness, tenderness in all these muscles. My muscles are tender right now as I speak.
Yeah.
and so, this kind of thing, it's a normal situation that people run into, but sometimes they overwork them so much that they have pain.
Okay.
So what we want to do is we want to shut those muscles down. So try biting on your front teeth. So put your fingers on the front again and try biting on your front teeth. Now your
There's
front
no
teeth,
bulge.
yeah, there's no bulge, right? So as soon as we bite on our front teeth, we're not putting our back teeth together anymore. There's no bulge.
Right.
And the reason for that is that when we want to bite something as opposed to chew something, we don't use the same amount of force. If we did, we'd probably snap off our front teeth.
Right.
So the system is designed that when you bite something, it decreases the amount of force. It's not the same as chewing. So what we do in the profession now, if we want to get somebody to stop clenching, to stop activating all these muscles, is we have to make an appliance that only puts a load at the front.
Okay.
So the appliance that we would use has a little bite pad right up here at the front, and when you bite together, it doesn't allow your back teeth to come together. And so if the back teeth don't touch, those pressure sensors on those back teeth are not firing anymore. And when they stop firing, it deactivates all these muscles.
Right. So there's no engagement.
Exactly. So for somebody who's a clencher, this kind of device works miracles. They notice it right away. They start wearing it and all that pressure is gone.
Nice.
And so that allows these muscles to kind of relax for them, and they can sleep better. So clenchers find very good results with this kind of an appliance. So if you're wearing a standard night guard that doesn't have that bite pad and you're a clencher, and most people are clenchers, not grinders,
Okay.
that night guard that you're wearing is probably not working for you very efficiently. So what you need is to get into this other kind of appliance, this relaxer type of appliance that keeps your teeth apart.
Okay.
And if you do that, that is going to really give you some relief. Now, a grinder, that's somebody different. How do we know if you're a grinder? Well, if we made you a guard, I would expect to see wear marks on that guard because
Okay.
you're grinding on it, okay? Grinders are hardwired to grind. You will not stop a grinder from grinding.
Okay, so it's a thing.
It's a thing.
Okay.
It's just that, about maybe 3 to 5% of the population are people who grind their teeth, and they're just hardwired that way. That's how they work. And so what we want to do in the profession is we want to protect their teeth.
Right.
Because those people are going to wear down all their teeth. They're going to have big problems, and so we want to prevent that wear. So a night guard is what we're going to put them into, and basically it's a piece of acrylic. It's flat, and it allows them to freedom of movement. They can grind away all they want. They'll wear out the night guard, not their teeth.
Right, which is key.
Which is key. So we want to preserve the teeth. So that's what we do.
Okay.
And then, when we get into, so this relaxer type of appliance is something that I use a lot of in my practice. And I've had very good results with that. Now, there are times where I may have to look and analyze somebody's bite and try to figure out what happened. And generally that's if the hand of man has been involved here. So there are people who've had extensive dental work done and then they can't find a comfortable bite. Mm-hmm. There are people who have had trauma, they've had accidents, they've had various things where things have gotten shifted around and they don't have a stable bite. And those people, we know that for those people that their TMJ problems are related directly to their bad bite. So that's where dentistry can intervene.
Right.
So there are times when the dentist can intervene and really make a big difference, and that's generally if a bad bite is due to extensive dental work, that maybe the bite hasn't been lined up, trauma, Orthodontics sometimes, they may move the teeth into a very aesthetic position, but they may not set up the teeth into a good bite.
Okay.
And that happens occasionally. So post-orthodontic work, sometimes we need to do an equalization of their bite. So there's different things that we can do for people that can help them, in those situations. If we're reconstructing their bite, we might want to get involved. Like I said, if I have to rebuild all the teeth, then I'm going to want to do an analysis of their bite and see how they're biting and make sure that I build them to a good bite when I'm all done. But outside of those scenarios, dentistry, we can help with bite splints, like I just talked about. But I think activating the rest of the medical system sometimes can be very helpful for these patients as well.
Right.
And joking aside, I do prescribe, they need to have relaxation techniques.
Yep.
Maybe they do need to take some yoga. Maybe they need to exercise and get some of that energy out of the system. Maybe they need to eat better, less caffeine, right? Because you don't want to wire yourself up even more. Yeah. And so there's a lot of lifestyle things that people can do to help with TMJ as well. Certainly massage can be useful. Physiotherapy can be useful too. Sometimes, this bad posture can lead to problems. So, and sometimes people are just so strung out that nothing's going to help them, and they may need to have an antidepressant or something to, take a Valium, right? And get the system to relax a little bit. So all of those things are all treatments that we use for treating TMJ issues, and they can all be effective.
Right.
So I hope that helps everybody to understand TMJ a little bit more. Thank you again for listening. Thank you.